My name is Fred Escobedo, and I am a cancer survivor. I am the primary caretaker of my children since I retired. We have 5 kids. They're all boys. This is the most difficult job that I have done in my entire life. And I've been in the military for 20 years in a combat zone. This is far more difficult than that. I noticed like something was in my throat, like I couldn't clear it.
Fred ended up having a squamous cell carcinoma, which is the most common cancer we see in the head and neck area. In addition, his was caused by the HPV virus, which is now really the most common cancer that we see in the back of the throat.
At first, I was in denial that I don't smoke, I don't do anything crazy, so why did this happen to me?
We, as physicians, owe it to our patients to look at them not as their disease, but as an individual. We are very lucky at Miami Cancer Institute to be able to provide our patients with multidisciplinary subspecialty access. Specifically in the head and neck, we see patients together, myself, the medical oncologist, the radiation oncologist, speech language pathologist, dental oncologist, when needed, will also join the group. The good news is with this particular type of cancer, it actually responds well to treatment, but we have to individualize which treatment is going to be best for the patient in the long run.
I receive radiation therapy and chemotherapy.
The patients who receive specifically radiation and chemotherapy in the head and neck, it can be a very difficult journey for them.
It was hard to eat. I lost quite a bit of weight.
To have the support services that are able to provide nutritional support, pain management is very important for our patients.
Everyone was very caring. The team at pain management was extremely good. Nutrition people were always trying to find different ways for me to keep myself healthy. Everything was in one location. It was very convenient and very helpful.
The subsequent imaging was concerning for a residual small amount of cancer in the back of his throat. Fred was lucky in that we now have access to transoral robotic surgery, which is a minimally invasive way of getting to some tumors in the back of the throat. And we were able to remove his tumor through his mouth with the surgical robot. He spent 1 night in the hospital and went home the next day.
I am cancer-free right now. The day I rang the bell, I felt, it was very emotional. I felt relief that the treatment was completed, and I was hopeful for the future. I would like to see my kids grow up, see my grandkids. I feel blessed to have a second chance in life.